Hey guys, today I'll be doing corticosteroids. I have pre-noted this and I'm gonna read it out. And this is a new way I'm trying to study through my notes instead of writing all over again uh, as a rough. So, corticosteroids, we're gonna do corticosteroids. It's a part of pharmacology chapter, which is uh, which is endocrinology. So this is corticosteroid from there. And so we're gonna start. So we have corticosteroids and basically all the corticosteroids they are from adrenal gland. So in the cortex we have three layers: zona glomerulosa and zona. Let me select the marker. I think this is good. This I think this one is cute. Yeah. So yeah. We have three layers: zona glomerulosa, zona fasciculata, and zona reticularis. So we have to know that glucocorticoids, basically, which are secreted by the glomerulosa, is maximum in the early morning. GFR, I'm sorry, glucocorticoids are not secreted by glomerulosa. GFR, it's aldosterone is by zona glomerulosa, and that means mineralocorticoids, fasciculata, these secrete glucocorticoids. So basically, they are they are very maximum in the maximum in the early morning. And actions like mineralocorticoids, they secrete basically aldosterone, which is the site of aldosterone production is DCT of the kidney, where resorption of the Na is taken in along with the water, the excretion of potassium and hydrogen occurs. Aldosterone basically it also causes myocardial remodeling. So in MI and all, it's not recommended because it will increase the hypertensive situation that is there. Now excess mineralocorticoid have to reduce the size. Yeah. So excess mineralocorticoid, there's retention of sodium water, there's hypokalemia, there's also alkalosis because excretion of H plus is happening. So there in the, it will be like, since excretion, more and more H plus is excreting out, the the body is going into alkalotic state. So this alkalosis that happens, and in deficiency, Addison's disease is happening, and in this hyperkalemia is happening. All the opposite things they are happening in hypertension. Now glucocorticoids, sorry, it's very aesthetic, like purple. Now glucocorticoids, the endogenous glucocorticoid and hydrocortisone. So hydrocortisone is basically the endogenous glucocorticoid which is produced by our body. It is catabolic in nature. That means it breaks down everything. Like it will break down lipid, it will break down it will break down proteins, um, like that. So if there is excess of glucocorticoid, there will be moon face, there will be fish mouth, there will be buffalo hump. So these are the clinical characteristics or facial or body characteristics that will be seen. There'll be negative calcium balance also, which will predispose the body to osteoporosis or the patient to osteoporosis. So it prevents increase in the permeability of capillaries also. So there's mild euphoric state, and in CNS and CVS basically. There's increase in permeability of capillaries. So there's mild euphoric state because all the chemicals will be acting up. It also aggravates peptic ulcer because of the all the release that is happening, and there's destruction of T cells and B cells also. It's an anti-inflammatory agent. Also, it inhibits the release of IL-1 and IL-2. So yeah, now now we have glucocorticoids, and it's a classification. We have glucocorticoids. Short acting is there, hydrocortisone and cortisone. G means it has more glucocorticoid action with maximum mineralocorticoid activity. So hydrocortisone basically have more of mineralocorticoid activity, although it's a glucocorticoid. Intermediate acting is 12 to 36 hours. This is 8 to 12 hours. It's prednisone. Prednisone, there are numerous, but I have only taken these examples. Long acting is dexamethasone, betamethasone, and paramethasone. They have high G and high G potency. Now, in mineralocorticoids, we have aldosterone, which is a natural hour. This fluodocortisone, it is M and maximum G activity. Aldosterone, it has most potent mineralocorticoid activity and most potent maximum M activity. And DOCA, it's a selective mineralocorticoid. Now, uses. Where do we use all these corticosteroids, or what are the steroids that are used in different diseases? Now, in Addison's disease, hydrocortisone is used. That we know. We did it earlier. In congenital adrenal hyperplasia, it's a congenital condition in which there's deficiency of enzymes. So, what happens is hypothalamus is secreting the release hormones, pituitary is secreting this stimulating hormones, but there's no feedback mechanism because there's no enzymes are not being produced. So adrenal gland goes into hyperplasia. So what happens is if a fetus is detected to have congenital adrenal hyperplasia, then in pregnancy hydrocortisone is given every 6 months. But if the fetus is male, therapy is stopped. But if it's a female, then therapy continues because then it will cause like a virulency, fertility related to fertility. Fertility will be decreased in females if you know, if this is stopped. Now, dexamethasone suppression test there is a test, dexamethasone suppression test. To it's done to diagnose different diseases, different conditions that are causing a deficiency or excess of the adrenal gland production. So dexamethasone, if it's given 1 mg orally at 11 p.m. night, then it is measured at 8 a.m. in the morning. If since glucocorticoids they produce maximum in the morning because of the feedback loop is there. So if cortisol is more than 5 microgram per day, there's no feedback inhibition. Like we have given dexamethasone this morning surge also. There's no feedback inhibition. That means there are excessive secretion of the cortisol. So, and if cortisol is less than 3, that means there has been a feedback inhibition and HPA axis is functioning properly. HPA axis is hypothalamus pituitary adrenal axis. Now, dexamethasone, it's given 8 mg. It's given 8 mg. If there's more than 50% reduction, that means it's a Cushing syndrome. It's due to pituitary adenoma because there will be feedback inhibition. If it's less than 50% reduction, that means there is a tumor or there's ectopic ACTH production because there'll be feedback, but these are tumors, they have to produce more and more. So So I've shown the tumor here, and I've shown a pituitary tumor. Try to show. Now, in antenatal, how it is helpful is beclomethasone, which is a mineralocorticoid. It helps in the fetal lung maturation. So corticosteroids, they're also used for those purposes. Also, it decreases cerebral edema. It is useful in TB meningitis, but it is contraindicated in intestinal TB because there is a risk of perforation. Now, or also in septicemic shock, because in shock there'll be a lot of things, um, like all the T cells and B cells will be very active. They'll be producing so much of things into the body. It will go into the shock. So corticosteroids, it helps in the reduction of uh, over oversurge of all these chemicals in the body, all the cytokines, all the leukotrienes, and all of that. So it helps in that way. There are other uses also, like Duchenne muscular dystrophy, which is an autoimmune sort of. The sarcoidosis, which is also autoimmune in nature. The spinal cord injury, this thrombocytopenia. So basically, it suppresses the body's action towards itself, and in course of that, it reduces the burden that body is taking because of all these chemicals. Now, adverse effects and contraindications. We'll have hypertension and edema. It's contraindicated in CHF. If there'll be chronic heart failure, if we are giving it is increasing hypertension, also it is contraindicated. And Cushing habitus, also it is contraindicated because already it's Cushing's. So in hyperglycemia also, because it is supposed to increase the blood glucose, so it is contraindicated in diabetes and osteoporosis also, because it shows negative calcium balance. It has it shows negative calcium balance, so it already predisposes to um, osteoporosis. Also is and contraindicated in peptic ulcer because it will cause perforation, and because bleeding and perforation, same thing. Now, contraindication steroids are also contraindicated in psychosis and epilepsy because they increase the capillary permeability, and they also cause osteonecrosis of the hip. I have tried to show diagrams that were available in the but there was no hip bone was definitely not there. So this heart, hypertension, edema, like the psychosis and all is there, epilepsy. There is Cushing habit. This hyperglycemia, as I have drawn a level. This is a simple method to remember what what all they are contraindicated and what all the cause if in excess. So secretion is increased, so glaucoma is there, limb muscle atrophy is there, ulcers are there, Cushing syndrome is there, osteoporosis is there, cataract is there, osteonecrosis, renal failure, tuberculosis, I for impaired healing, C is for contraindicated in CHF, C, O is edema, E, I is infection, and D is diabetes mellitus, and S is suppression of the HPA axis. So these are the things that it is not given in glucocorticoids. It's a mnemonic. Glaucoma, limb muscle atrophy, ulcers, Cushing syndrome, O for osteoporosis, C for cataract, O for osteoradionecrosis, R for renal failure, T for tuberculosis, I for impaired healing, C for contraindication in CHF, O for edema, I for infection, D for diabetes mellitus, and S for suppression of HPA axis. Also, cholesterol, when it is converted to pregnenolone, it is inhibited by a drug called aminoglutathione. glutathione, which is a drug used for breast cancer. Just an additional information. Now, drug for bone remodeling. There are there are a lot of drugs like these. This is a section that starts with the osteoporotic drug. So, drug for remodeling of the bone is PTH because PTH is supposed to increase the blood calcium and phosphate levels. So, this is that, and FGFR. Sorry, FGF 23. It inhibits actually calcitriol production. So it will inhibit the calcitriol production. And D2, vitamin D obviously helps in the you know post translation of so many post translation of effects of calcium and all, and related biochemical reactions. So D2 is basically ergocalciferol and D3 is cholecalciferol. So these are sometimes asked which is which, and they're very confusing. Now, out of it's like it's not related, but it's related, but it is like out of the blue information, which is Burosumab is for X-linked hypophosphatemia, which means that phosphate level, oops, that phosphate levels are sorry, actually, let me write it properly. The hypophosphatemia means the phosphate levels are low. It's X-linked. So the monoclonal antibody, it's a Burosumab is actually a monoclonal antibody against FGF23 that will decrease the calcitriol production, which is like the parathyroid hormone. Now, basically, drugs that are useful for the osteopetrosis, they inhibit the resorption. First, we have to inhibit the resorption of the bisphosphonate, denosumab, cinacalcet, and calcitonin, estrogen, SCRNs, and gallium nitrate, etc. Now we have to have something that stimulates the formation of the bone. So there's teriparatide, calcium calcitriol, and fluorides. Now, now there's a drug strontium granulate, which have both the actions. It also causes inhibition of the if it's given like in pulsatile form, it will form the bone, but if it's given continuously, it will inhibit the formation of bone. So both actions are there. So that's about it. I've not gone in details of it, but bisphosphonate basically has a lot of functions, like a lot. It can cause shock, stick fracture also, which is a fracture of trochanter. Trochanter, basically trochanter is this part, this bulbous part of the bone, long bone. So yeah, it can cause shock stick fracture. And it is also like zoledronate, and there are drugs that zoledronate is there. It is contraindicated in certain kind of cancers. Let me recall it back. Wait. Yeah, so zoledronate, it can also cause like CMI, which is uh, chronic myeloid leukemia, CML, and also in this, yeah, there's also esophageal irritation. So in esophagus, so when we are having bisphosphonate, it is indicated that we drink water along with it, and we cannot have food because to make it go straight in the stomach, because if it comes in contact with the esophagus, it will cause irritation. And there there are like three generations of it. So the first generation is least potent, and the third generation is most potent. And zoledronate, yeah, I told you that it is used for CML. It can cause osteonecrosis of the jaw also. They are basically used in the treatment of postmenopausal steroid let me write it down. Postmenopausal steroid induced um, osteoporosis, and then Paget's, obviously, and hypercalcemia of malignancy. Hypercalcemia of malignancy. If there's a malignant tumor, malignancy, if there's malignant tumor, then hypercalcemia can occur of that tumor. Hypercalcemia of that tumor can occur, and it is given like pamidronate and zoledronate by IV route is preferred, which is like the third generation compounds. They are most potent. So this was about it. Now this also like SERM is basically selective estrogen receptor modulator. So it increases anti-resorptive like IGF-1 and TGF-beta, but like pro-resorptive IL-1, IL-6, and TNF-alpha, they decrease that. And this teriparatide is basically recombinant PTH only, but radioactive. They they improve the bone density everywhere except distal radius, which is like a radius. Sorry, I don't know the reason about for this, but somehow this happens. So mm, because of this, hypercalcemia can also occur, and it actually improves the it's used for chopstick fractures, like as a treatment method. And other I have done in my previous video, I have done donizumab and sinacalcet and all. That can be checked because I was just too tired after writing all this. So I did another rough video. So yeah, and this is it. This is for corticosteroids. Thank you.